Welcome to IRACON-TV. This is Dr. Ramya Puligari, consultant rheumatologist at HRC Hospital, Hyderabad. Today, we have Professor Joan Merrill along with us. She is a professor at Arthritis and Clinical Immunology, Oklahoma University State Research Foundation. Welcome to Hyderabad. How do you feel about IRACON?
It's really been a lot of fun. I saw things yesterday that make me feel good that all of us around the world are advancing in our thinking in almost parallel ways. And it gives me a little bit of hope for our field.
So I have a few questions for you. What are the major challenges of systemic lupus trials you face and how to overcome the problems, especially in India?
Well, the first thing we need to do in India is get more trials for lupus here. It isn't just that it would be good for Indian patients to have the opportunity to try some of these novel drugs that are being developed, but the world needs India because you have many well-trained doctors who are very careful about what they do, and which is what you need in clinical trials. And you also have many patients, which will help us to get these drugs developed. Right now, there are so many companies developing treatments, and we don't have enough patients to be in the trials.
And what are the major drug trials to watch for in 2023-24?
Well, we have some phase 3 trials that are ongoing. One is obinutuzumab, which is a very deep depleter of CD20, or CD20 positive cells. So it's a B-cell depleter, and it had some very promising results in phase 2 for nephritis. And, of course, we need better nephritis drugs. We're not there yet. When you look at any trial results, you'll always find a good substantial proportion who did not improve, at least to the level of the outcome measure, and we need to get there. Others for general lupus development include telitacicept, which is a inhibitor of both BLyS and APRIL. So it has a little bit of a wider mechanism of action than belimumab. And then we have some JAK inhibitors that have done very well in phase 2 and are going into phase 3. One is deucravacitinib, and which is a TYK2 inhibitor. TYK2 is the cousin of the JAKs. It's really a JAK. Just has a different name. And then there's a JAK1 inhibitor, upadacitinib, yeah. And that one has just about to be published, and that one will be going into phase 3 as well.
And my last question, what are your views about IRACON 2023?
Well,
scientific views.
Well, I was very pleased to see a paper yesterday presented by a young investigator looking at, really sophisticated analysis of which patients might get better with cyclophosphamide. And I know that cyclophosphamide is widely used here for nephritis, and it's distressing to think that such an effective drug, which it is, doesn't work for everybody. And if we could pick out in advance who is less likely to respond, that would be wonderful. And they did some deep phenotyping using, sort of looking at gene expression, and also looking at, they actually found some non-coding regions, which are very important parts of our genes because they may have a lot to do with how genes get made. They regulate how genes get made. So these may be important. And, I'm going to wait and see what they do next with all of this data because it should be intriguing.
Thank you, Professor Merrill. Have a great time.